Intermittent fasting has profound beneficial effects on multiple health measurements, including diabetes, metabolic syndrome, cardiovascular disease, and neurologic diseases such as Alzheimer's and Parkinson's. But did you know that there is growing medical evidence that intermittent fasting has an antidepressant effect? Yes, intermittent fasting may improve depression. I'm Dr. B. Welcome to my channel. I'm a board-certified fellowship-trained physician, and I make medical educational videos. In this video, I'll teach you the neurochemical, anatomical, and medical basis for how intermittent fasting works. Then, I will teach you how to plan and create your own intermittent fasting schedule, and watch to the end to learn the optimal time-restricted eating schedule. To understand intermittent fasting, we must talk about BDNF, brain-derived neurotrophic factor. This is a substance secreted in the blood that supports growth and survival of nerve cells in the brain. Some describe BDNF as brain fertilizer or growth hormone for brain cells. This is important because BDNF makes new brain cells grow and allows existing cells to live longer in areas of brain that are important for depression, like the hippocampus. In addition, BDNF increases plasticity, which means it helps new and existing brain cells in the brain build new connections and networks and adapt to new stimuli that come into the brain in the form of new sounds, sights, and ideas. This helps with depression and also memory. BDNF is known to increase serotonin, which is what many antidepressant medications do. Now, keep in mind this is important because a known cause of depression is low serotonin. In addition to raising BDNF levels, intermittent fasting also releases a hormone called Ghrelin from the intestines. This, then through a series of steps, also acts on the hippocampus in the brain, similar to BDNF, to promote new nerve cell growth and preservation of existing cells. Intermittent fasting causes an increase in blood levels of ketones. Think keto diet, and ketones, when they increase in the blood, increase BDNF levels and again have a beneficial effect similar to an antidepressant. So to get the antidepressant effects of intermittent fasting, how do you create an intermittent fasting schedule? Well, the most common and easiest is known as time-restricted eating. To do this, first examine your current eating schedule by identifying your breakfast time and then identifying what time in the evening you consume your last calories. This defines your eating window. Now, this includes alcohol or other caloric drinks or snacks in the evening. For example, if you have a 7 a.m. breakfast and a 6 p.m. supper, your eating window is 7 a.m. to 6 p.m. or 11 hours. If you snack until 10 p.m., then your eating window is 7 a.m. to 10 p.m. and is 15 hours. Now, when you've identified your eating window, then count the number of hours left before your next food, and this is your fasting window. In this example, if you finish ice cream at 10 p.m. and then you have breakfast again at 7 a.m., your fasting window is 9 hours. The goal of intermittent fasting is to adapt your eating schedule to follow a planned schedule where you eat during a predefined time period and then fast for a predetermined time period, not randomly. Now, the most common schedules are 12 to 12, 16 to 8, or 18 to 6. This means with a 16 to 8 schedule, your eating window is 8 hours. If you have breakfast at 7 a.m., then your last meal of the day will be 3 p.m. Your fasting window is then 3 p.m. until 7 a.m. the next morning. The easiest way to alter this is to delay breakfast, such as having breakfast at 9:30. Then your evening meal can finish by 5:30. You can pick any start or stop time, just count ahead 8 hours to define your eating window. Each individual has different needs that will determine the schedule that will work best for them. For example, if your last meal is at 3 p.m., then going to a home where everyone else eats an evening meal, which you then have to skip, is a difficult plan to keep consistent with. Alternatively, if you work in a job where eating breakfast at 9:30 is impossible, you will likely have to choose an alternative schedule. Now, an additional technique that individuals find helpful to keep in mind is choosing a schedule so that you sleep during a significant portion of the fasting window. Once you've chosen your schedule, for example 16 to 8, which means 16-hour fasting window and 8-hour eating window, it is recommended to begin gradually, with some recommending taking as long as 4 months to gradually put it in place. One easy technique that is tolerated is to change your schedule by 1 hour per week, and each Monday change it by an additional hour until you reach your goal schedule. If this is too drastic, you can begin by changing 1 hour per week, but only on 4 days, and gradually work up as well. So, Given the multiple schedules, which is most advantageous? Well, the 16 to 8 or 18 to 6 schedules demonstrate a significant increase in BDNF, that is the growth hormone for the brain, above the 12-12 schedule, or those that use an eating window greater than 8 hours. So, optimally, choosing an 8-hour or less eating window is most likely to give the most benefit regarding antidepressant effects. And there are additional published studies that suggest that eating earlier in the day is likely to give the most dramatic rise in BDNF and other favorable substances. Thanks for watching. If you're interested in more medical topics, try this video on bipolar 1 and 2 disorder, or this one on traits of borderline personality, and please don't forget to hit subscribe.